Hello and welcome to Health Matters on Channels Television. I am Yomi Otaigbe. Do you or someone close to you experience recurrent attacks of breathlessness or wheezing sound in your chest? If so, you need to pay extra attention to our discussion today on the program, which is centered around asthma, a respiratory non-communicable disease which is common among children. To shed more light on this condition, I have with me in the studio a consultant chest physician who is also the head of respiratory unit of the Obafemi Awolowo University Teaching Hospital, Ile-Ife in Osun State, Professor Gregory Erabot. Good to have you on the show.
Yeah, thank you very much for having me.
Thank you for coming. Tell us more about asthma and how it affects the lungs.
Yes, asthma is from the original name of asthma. It means difficult to breathe, and it's a disease that causes narrowing of the airways and makes it difficult for those who have the condition to breathe properly. And so they exercise symptoms like cough, chest tightness, wheeze or whistling sound, and then sometimes they may have all kinds of allergies associated with it. So that is basically the problem. They have chest tightness, they have cough, they have wheeze, they are breathless, and they may have associated allergies.
Okay, so it's something that has to do with, as I said, the lungs and the airways.
Yes, mainly the airways, and that is the airways that causes the narrowing. But the initial problem of the asthma itself is what we call an inflammation. The airways are inflamed by a lot of cells, and the consequence of that inflammation is the narrowing of the airway. So inflammation is what causes the airway narrowing, and the airway narrowing is the expression of the inflammation in the patient.
Okay, so why will the airways be, inflamed?
Yes, there is a lot of hypotheses, but the almost certain thing we know is there's a combination of genetic and environmental factors. As we always say, we say the genes give us the gun, environmental factors trigger up the attack. And so when families have people in their family has asthma or has allergies like rhinitis, that is, they have running nose, or they have sore throat, or they have itchy eyes, runs in families, they have a predisposition to have asthma. But it doesn't necessarily mean that if your parents have it, you must have it.
Like you were trying to explain to us earlier what happens to the airwaves. As we can see on the screen, there seems to be that on the left side. For me, it's normal airways.
Yes, clear airways, yeah.
Okay, and then there's the narrowing.
Narrowing airways. And what we are trying to avoid, if you look at the one with clear airways, then in the middle one, you see the airways are narrowing, and the latter one, the airways are really narrowed properly. We don't want a situation in which the airways get so narrowed and it changes the whole geometry of the airways. And so we want a situation in which if your airways are narrowed, you have treatment regularly and frequently, and that prevents a structural damage to the airways.
Okay, now tell us more about the causes or the risk factors for this. Yes. We're talking about genetics.
Yes, the risk factors is genes, and we don't clearly know. There are several genes that have been implicated in asthma, and as we always say, it doesn't follow the Mendelian fashion. That is, it doesn't necessarily mean that if your father or your mother have it, then you will have it. It can skip a whole generation. So there must be a gene predisposition. And the markers of those genes are shown by allergies in your family or full-blown asthma. Then after that, you also have to have the environmental condition that favors the attack. And the environmental condition can be divided into different forms. One is the indoor environmental condition. We call things like house dust, things like fumes at home.
So there's the things that can trigger asthma.
So indoor environmental factors, like cockroaches, like house dust mite, like pungent odors. They will have outdoor environmental factors, which also have things like pollens, change in weather, exhaust pipe, changes in industrial pollution. And then we also have other allergens like drugs. There are several drugs which we know can trigger asthma. Then there are non-specific factors like emotions, like pregnancy, like menstrual period.
We see in that picture a woman laughing, you know, that could...
Yes, a laugh can do for some people.
Wow.
So most of these things are rather inciters. To some it may cause asthma, to others may not cause asthma. And that's why we always say, study your own asthma so as to know which factors that trigger your asthma. What may trigger A asthma may not trigger B asthma. So from your own experience, you can easily identify the factors that can trigger your asthma.
Now, some other conditions I would guess, you know, can mimic asthma. You find some other people having breathing difficulty and they have not been diagnosed with asthma. Tell us about this other condition.
Well, there are several conditions that can mimic asthma right from childhood. There's a condition we call acute bronchiolitis that can mimic asthma. Some viral infections can also mimic asthma. When it now comes to the adult, things like congestive heart failure can mimic asthma. But one of the greatest mimic of asthma is a disease we call chronic obstructive airway disease. Now that disease is similar to asthma, but the difference about that disease and asthma is that it occurs in the older age group and is usually usually caused by smoking or indoor pollution. All other things are not really as close to asthma because there are very few conditions in the normal state that can give you wheezing, chest tightness, and cough. And so in many cases, if it wheezes and you wheeze at night, you are associated with allergies, you have a